Alexandra Salazar, and Alexandra is a surrogate here with Yulon. Alexandra is from Oregon, the state of Oregon. Medford is the city. And I'm going to ask her some questions about being a surrogate. First of all, welcome to Chicago.
Thank you.
Okay. And I'm going to ask you a few questions about being a surrogate and about your situation, your living situation, your family, and this and that.
Okay.
Alexandra, have you ever been a surrogate before? And if so, how many times and when was the last time?
I've never been a surrogate.
What made you decide you'd like to become a surrogate for a couple that want to have a baby but can't conceive children?
It started out as an idea, I love my kids so much. I have 7 of them. And 2 are biologically mine, the other 5 are stepchildren. But I love them so much that I really wanted to be able to give that gift to somebody else. Kids are beautiful and they bring so much joy to my life that I couldn't stand the thought of somebody being able or wanting to have that and not being able to have that.
What are your values regarding surrogacy? How do you feel about it? You've kind of explained it anyway, but if you want to.
I'm really excited about it. Like I said, I want to be able to give somebody a child who maybe otherwise wouldn't be able to have one.
Good. Can you tell me a little bit about your family? Are you married and do you have children?
I'm not married. I'm in a partnership. I've been with the same man for 7 years. We have 2 beautiful children together, 2 boys. AJ is almost 5 and DJ is almost 2. And then I have 4 stepchildren. Chris is the oldest. He's 19. He's out on his own doing teenage things, as most 19-year-old boys probably do. Brianna is 17. She's a junior in high school. She does cheerleading and loves it. Getting ready for prom in a month. I'm not ready for her first prom. And then Gabe is 14. He plays football and he also cheers. He's 6'3", 230 pounds. He's enormous. He looks like he's 19 years old. So I try to tell him he's still my little boy. And then Katiana is 12, and she is very studious and driven and focused and likes school and theater. She's recently signed up to do a Little Mermaid play. And then my 15-year-old sister also lives with us. And so my sister does cheer and softball, and she's very active and loves the busy family, because when she was with my parents, she was the only child left in the house. So she loves living in our house and being active. Yes.
Good. You told me a little bit about your family just now. Can you tell me a little bit about your life partner? What's his name?
Daryl.
Oh, tell me a little bit about Daryl and describe your relationship, please.
Goodness, Daryl is probably the best thing that ever happened to me. I met him when we were working together at Red Lobster, and we've both really evolved in our relationship, both individually and together, and that's been great. He's an awesome partner. He's a wonderful father. He's very active. He enjoys weightlifting and being fit. We currently work for the same company, so we get to work together again.
What is that? Who do you work for?
I work for La Clinica. It's a primary care clinic in Medford, Oregon. I've worked there for 8 years. I love what I do. I love healthcare.
And what is he doing there?
He is in management. He's in training to be a manager.
At the same company. Okay.
Yeah.
Do you or your husband Daryl have any reservations regarding the legal relinquishment of the parentage after birth?
No. I've thought signing up to be a surrogate has been a process of about 18 months for me. I've been thinking about it for a long time. And so, I know going into it that this is not my baby, that I get to love it and take care of it and, be there for it during the first 9 months of its life. And after that, I get to hand it off to a wonderful set of parents.
That's very good. So. Do you have a solid support system from your family and or Daryl to help you face the feelings that may be overwhelming during the pregnancy?
Yes.
Can you describe
I do.
that?
Yeah. Obviously, I have Daryl, who's been with me throughout this whole process. I have 5 cousins that live there in the valley with me. We get together very frequently. And so my main support in my cousins is Frida. We work out together every day. She watches my kids. And she has carried and would love to carry again. She's had 3 kids, but she just has really hard pregnancies. And so she really understands where I'm coming from and why I'd like to do this.
Okay. Can you describe the maternal feelings you experienced during your prior pregnancies and how you plan to deal with those feelings as a surrogate if they come up?
I mean, maternal feelings, it's overwhelming joy. It's, butterflies, and I plan to experience those feelings and have those feelings when I'm pregnant again.
Good.
I don't think you can prevent them from happening. And I think a lot of it is just about knowing that in the end, I'm going to give this baby to a wonderful family.
Oh, very good. Wonderful. That's very great. Have you ever experienced any complications during pregnancy? And if so, can you describe what kind?
I've never experienced any complications. I've had very easy, successful pregnancies.
Very good. How do you take care of yourself when it comes to your health during the pregnancy?
I continue my exercise regimen. I watch what I eat. I am right now a bit of a coffee drinker, so I always make sure and cut that out. Has never proved to be an issue to me in the past. And I just do what I already do. Self-care is really important to me. Being in healthcare, I think it's one of the things that we preach the most. And so I really try to practice what I preach. And take care of myself.
Can you describe your diet on a typical day when you were last pregnant in some detail?
Yeah. Generally, I have oatmeal with some milk in the morning, because I did get morning sickness. So eating a little something always, calmed my nausea. So oatmeal with milk or juice in the morning. And then I'd have a granola bar or a banana, something like that, for a snack while I'm at work. For lunch, it really just depends on what I feel like. It's kind of my indulgence meal. So if I feel like a salad, I'll have a salad. If I feel like, some pasta or whatever, that's what I would have. And then afternoon snack, generally fruit. I love fruit. And then dinner, I am Hispanic, so we do a lot of rice and beans.
Like the Chinese. Rice.
Yeah. Chicken. Or I do eat pork, so sometimes chicken or pork.
Good.
Yeah.
Yeah, this is along the same line. As a surrogate, will you strive to eat a healthy diet and reach out for support if you need to?
Yes.
Okay.
Yeah.
Should you become overwhelmed with morning sickness or other reasons that may prevent you from getting the proper nutrition, can you, for you or your baby, will you seek help?
Yes.
It sounds to be like you don't need to do that. Okay, already. Should more than one embryo be implanted and all of them succeed? What are your feelings regarding fetal reduction and abortion if it's the couple's wish to have no more than one child? Would you? And then the second thing is, would you be willing to carry twins?
So I don't want to selectively reduce or abort. I really want to give somebody a child, but I couldn't make that. I couldn't make the decision. I couldn't have that on me that I chose to end a life. So I would not like to selectively reduce or abort, and I'd be more than happy to carry multiples. Yeah.
Are you willing to work with your surrogate agency, the IVF doctors, OB-GYN doctors, to take all the necessary tests and screening to qualify and to travel out of state for operations if necessary?
Yes.
Are you willing to work under the instruction of surrogacy supporting staff to provide all the data and information that is requested by the client?
Yes.
What kind of expectations do you have for your relationship with the intended parents couple after the birth?
I don't know that I could have any expectations right now. I think that as I meet with them, as I talk to them, we can see how the relationship develops and then feel, what we think is appropriate. I'd hate to put any impositions that, I'd want something right now and then the relationship feel like it calls for something different.
Good. Very good. Would you expect to see a Christmas card every year and a photo of the baby?
Again, I think it just depends. I mean, I think it would definitely be nice to be able to have that every year, but I'd hate to put an expectation when I don't know what that relationship might look like.
And the last question's in the same line. Do you have any desire to have future contact with a child as he or she grows into adulthood?
I mean, I think I do have a desire to have contact, but yeah.
Okay. Another sensitive issue is abortion and adoption. Adoption, particularly, we're going to get to here.
Okay.
Abortion generally is not allowed in the ULAN Surrogate Assessment Program terms of services. We've consulted with the intended parents clearly on this and asked them to sign the terms of services before ULAN took them into the program.
Okay.
But in case the couple gets divorced or either of the two of them passes away during the pregnancy, would you consider accepting an abortion?
An abortion?
Yes.
No.
Okay. If the above-mentioned tragic events occurred and you do not prefer an abortion, would you be interested in adopting a child through an arranged agreement?
Yes. Yes. My little sister was adopted into our family, so
that's very
I
nice.
think
Good.
that's a very viable option.
In the case the newborn is found with some kind of birth defect, disease, or disability to some degree, even though the intended parents are required to take the child after birth, it's our job to ask you your choice for possible adoption of the newborn. Can you share how you feel about this?
I mean, I think that I would hope that the intended parents would want it one way or the other.
Right.
And if not, and I was asked what I thought about adoption, like I said, I think it's a viable option, but I would hope that the intended parents would be happy with whatever blessing they received.
And just so that you can change your mind at any time. That's just a general question.
Okay.
This is not pitting you down or
Yeah.
anything. I just want to know how you
Yeah.
feel. Yeah. Okay. Next question. Would you be willing to travel to China for the possible embryo transfer cycle procedure? If this is arranged, both male and female intended parents had blood tests conducted in the U.S. FDA lab. You may be asked to go to China because some of our intended parents have their embryos stored in China and cannot have them transferred to the U.S. The China Yulon contracted hospitals agreed to accept non-Chinese surrogates for embryo transfer procedures in the event the child is delivered outside of China. So the question is, are you willing to go to China for a short period for this transfer?
No.
Okay.
I wouldn't be able to do that.
Okay. The next question. Are you comfortable providing breast milk feeding to the newborn baby?
Yes.
Do you currently have a relationship with any surrogate couples, any intended parents? If so, could you describe that?
Any that are currently surrogates or that have been surrogates?
Well, let's say the ones that are currently surrogates.
No, I don't.
Okay. And how about, do you have any relationship with any surrogates that you're intending on having a surrogacy relationship with?
No.
Okay. Are you willing to work exclusively with Yulon for at least 12 months as a condition of the surrogacy acceptance program?
Yes.
In the event of a failed embryo transfer cycle, are you willing to start the next embryo transfer cycle for the same intended parents or possibly new intended parents?
Yes.
Would you be willing to start the next cycle immediately, or would you prefer to start the next cycle in 1 to 2 months?
I think immediately would be fine.